Even if you come from a sunny climate, you must be aware that the sun in most parts of Australia poses a danger. Australia has the highest incidence of skin cancer in the world. And being sun-safe, which means wearing sunscreen, sunglasses and a hat, is really important.
So at any time that you are going outside, that you're walking, if you're going to sit in the sun, make sure you wear a hat, long sleeves and sunscreen, because you will get burnt even in the winter.
There are a few other health issues for you to worry about. Australia's level of public hygiene, the safety of its water supply and healthcare all meet the highest standards.
Being healthy and happy means more than sunscreen and eating well. It means enjoying your study and your social life. So it is important that you make friends. There will be many opportunities at your institution for socialising with fellow Australia Award students, or perhaps by joining one of the many organisations for students with particular interests. There will also be groups in your community, including those from the same national background as yourself.
We also have a big social program for our students, and that's really aimed at getting the students to know each other and so they've got friends on campus.
It's very helpful. You tend to meet friends, you keep contacts, you continue networking, Facebook and the like. And sometimes you go for barbecues as a group, and that's very interesting.
Get to mix with international students, get to mix with Australian students, and then you should be okay. There shouldn't be any problem with that.
In Australia, it is illegal to discriminate against anyone because of a disability. This means that if you have a disability, public buildings must be accessible to you, and you should be free to participate in the activities of your institution and your broader community.
The university has a student support service. Part of the student support service branch, it does have a disability section that is required by the institution to supply for students with disabilities, not only international students but local students.
No matter how well you have prepared yourself or how welcoming your educational institution has been, there is still a very good chance that you will experience culture shock. You might experience it as homesickness, alienation or anxiety.
Educational institutions are very familiar with this reaction among international students and can help. For example, with on-campus counselling.
The best thing is talk about it. Don't bottle it up. The first point of contact would be your student contact officer.
Get involved in the activities on campus, speak with your fellow students, speak with the international office. If it gets very bad, come and speak with the counsellors on campus.
If you do develop a medical problem when you are in Australia, you will be covered by insurance called Overseas Student Health Cover. Your institution will pay for this insurance. It covers medical and hospital expenses, prescription medicine and ambulances. It does not cover dental and optical services, physiotherapy or pre-existing conditions, such as pregnancy. If you bring your family to Australia, you will be responsible for purchasing their health insurance, and some things may not be covered in the first 12 months, including pregnancy.
You know, it's pre-existing in the sense that before we came to Australia, that condition was there. There we had to dip into our pockets and pay for those bills.
Doctors responsible for the general health of the community, called general practitioners, are available on most campuses, as are dentists. Your student contact officer can provide you with more information and direct you to the best medical centre for you and any family members.
Students do not need to pay up front. The medical centre will directly bill Medibank. If students visit another doctor, a private doctor in town, they will need to pay up front. They will need to then go to Medibank to receive their money back, and there will be a gap payment between what they have paid and the amount they receive.